Good morning, everyone. 20 new cases overnight, 9 linked, 11 still under investigation. 7 were in quarantine during their entire infectious period. At least 7 spent some of their infectious period in the community, and the balance, the remaining 6 cases, investigations continue. We've had a slight increase in the number of people in hospital, up to 10. And we have 2 people now in intensive care, 1 requiring ventilation. Yesterday, nearly 3,400 tests were conducted. This is a good level of surveillance across the community. So thank you to those who came forward for testing. A reminder that if you have any symptoms, please come forward for testing immediately. You must isolate whilst awaiting your test result. So don't go to the testing centre via a supermarket or a drive-through. This is one of the areas of risk that we have experienced. In compliance, generally good feedback from ACT Police, Access Canberra and WorkSafe ACT. 662 traffic stops yesterday and only 3 directions to leave the ACT. Business compliance continues to be very good, with the 2 consistent themes that I've been raising every day now. Incorrect or not wearing of masks in some business settings, and workers not checking in to their place of work. So just another reminder, the whole point of masks is to protect you, your work colleagues, and any customers that you have any interaction with. So it's important to wear a mask and to wear it properly, please. On the vaccination front, another great day, a record for vaccinations in the Territory. 4,737 receiving either their first or second dose. I can report that 80% of our over 70s population are now fully vaccinated. I believe we are the first jurisdiction in Australia to achieve that milestone for our over 70s population. Based on the first doses of that age cohort, we expect to be able to reach over 95% fully vaccinated in the coming months. More than 90% of our over 50s population have now had a first dose of the vaccine. And we also expect this cohort to reach more than 95% fully vaccinated in the coming months. The first dose rates for 40 to 49-year-olds is currently at 85%. And again, I think this is an encouraging sign that this age cohort will track towards 95% fully vaccinated in the coming months. Demand for vaccines in the ACT remains very strong. There are 75,000 people now booked for their first vaccine dose at ACT government clinics, the vast majority of these being Pfizer bookings. We have close to 250,000 people who have now received at least 1 dose of a vaccine. We can expect to have at least 325,000 of our city's residents vaccinated, and this could grow even larger with additional vaccinations being provided through our primary healthcare network. The key thing to look at here will be the take-up of the Moderna vaccine through pharmacists when that arrives later this month. There are, of course, a lot of people still to vaccinate, and this is going to take some time. For most unvaccinated Canberrans during this outbreak of the virus, the very clear advice is that the best vaccine is the one that is available to you today. That having the protection of at least a first dose, and then even more importantly, being fully vaccinated as soon as possible, is the best thing that you can do to protect yourself and your family. If you can get your first dose earlier with the AstraZeneca vaccine and become fully vaccinated, you really should consider this option. Turning now to the construction industry. This Friday will see the recommencement of the balance of the ACT construction industry. As with the larger construction sector, there will be stringent COVID-safe requirements in place in order to reduce the risk to constructors and to households. There is to be no interaction between workers and residents within a construction site, a renovation site, any premise. The ACT COVID safe construction guidelines reflect the arrangements that are in place in New South Wales and Victoria. There will be a further industry briefing this afternoon ahead of the restart of work across the balance of the construction sector on Friday. Now, there's a lot of interest in what the future looks like. In short, we are going to be facing a challenging few months. Until we exceed those vaccination targets that provide the community with the protection we need, we can only gradually ease restrictions. Our primary goal remains the health and protecting the health of our community. We are very acutely aware of the need to also consider the economic impacts and the mental health and well-being impacts that come from ongoing public health restrictions. But to be as blunt as I can be, if the virus gets out of control in Canberra, we will experience even greater health and economic challenges than we are right now. We can't let that happen, and we won't. But it will be a balancing act over the coming weeks and months. The best thing that the community can do, that any individual in Canberra can do, is to get vaccinated as soon as you possibly can. If you have any symptoms or you've been to any of the exposure sites within the timeframes identified, you must come forward for testing and you must isolate whilst we get your test result to you. And you must follow the public health advice. The only way that we can gradually ease our restrictions in the coming weeks and months is if more people get vaccinated, people who have symptoms or who've been to exposure sites come forward for testing and isolate, and we continue to follow the public health directions. If we all do that, then we can gently step our way out of the situation we are in now. If it goes the other way and we see our case numbers explode, we will not be able to further ease restrictions in the coming weeks. So our preferred pathway, in partnership with the community, is to see vaccination numbers continue to set new records day on day, that those who do unfortunately contract the virus through no fault of their own come forward for testing, isolate and quarantine, and that everyone follows the public health directions to protect each other. Now, I know there's some people who really just don't seem to care about the rest of the community. But for those people, care about yourself and those closest to you. Because most of the transmission is occurring when someone gets infected and brings the virus back into their own home and infects the people closest to them. That's the saddest part of what we've been seeing over the last 4 weeks. So in conclusion, for those who've joined late, a quick recap. 20 new cases, 9 linked, 7 in quarantine during their entire infectious period, at least 7 infectious in the community for part of the time, and 6 still under investigation. 10 people now in hospital and 2 in the care of our wonderful team in the intensive care unit at Canberra Hospital. And as always, our thoughts are with the family and friends of those individuals. It's tough, and it would be incredibly hard if one of your loved ones was in intensive care. So we send our love to those families.